Thank you very much, Health Minister Kweku Ajiman Menu. And for those of you watching us from the comfort of your homes, well, for those of you also watching on social media, we have the Vice President of the Republic of Ghana, His Excellency Dr. Alhaj Mamadu Bawumia, and he will do the formal launch of the COVID-19 tracker. And I believe that we have the Vice President on now.
Thank you very much,
Excellent.
Chairman General, Honorable Ministers of State, Members of Parliament, artists, distinguished guests, viewers on TV, and followers on social media, the media, fellow Ghanaians. It is really an honor to be part of this unique launch of the COVID-19 tracker app for Ghana today. Let me first of all commend the Honorable Minister for Communications, Honorable Mrs. Ursula Owusu-Ekufo, and her team for the hard work that they have done on this app and making it possible for us to launch it in the shortest possible time. Of course, the latest figures tell us that some 1.7 million people have been infected by the coronavirus, and about 107,000 people have died as a result. And this has affected almost all countries in the world, and this has taken place just over the last 6 months. In Ghana, our country recorded its first case of COVID-19 on March 11th this year. Within a space of 1 month, we've gone from 1 case to 566 cases with 8 deaths as at yesterday, April 13th. The impact of this pandemic on humanity and the world economy is enormous, and our country, Ghana, is of no exception. Businesses are shutting down, workers are losing their jobs, and the lives of our dear ones are being taken away. As the President, His Excellency Nana Addo Dankwa Akufo-Addo, has said, our approach in combating COVID-19 is going to be driven by science and data. In this regard, data is the most powerful weapon in our fight against COVID-19. Fundamentally, you cannot fight what you cannot see. So we cannot be groping in the dark. So the data will point us in the right direction. So our focus in Ghana on dealing with COVID-19 has been basically on the 3 T's. You are tracing, you are testing, and you are treating. So tracing, testing, and treatment are the essential pillars for our fight against the coronavirus. In the context of contact tracing, what we are trying to do is to identify all the people who have been in contact with a positive person so that we can test them as well. To do this contact tracing, we have deployed about 450 teams across the country. And what Ghana is doing is very, very important, because Ghana is doing what even the most advanced countries such as the US and the UK are not doing, and in fact many other African countries as well. So even though we're a small developing country, in this particular area of contact tracing to deal with the coronavirus epidemic, we are ahead of countries such as the US and the United Kingdom on this. Secondly, we are pursuing a strategy of aggressive testing. And in terms of testing for the coronavirus per capita, Ghana is, on the basis of the available data we have, Ghana is in the top 20 of countries in the world. And on the basis of this data too, in Africa, For example, we are #1 per capita in terms of testing. In terms of numbers of tests, South Africa leads, we are second, but in terms of testing per capita, that is per our population, we are leading the continent. In Ghana, as at 11th April, we've tested 37,954 people. If you look at Africa as a whole, the data seems to show that total tests on the continent are under 100,000 people. In Ghana, we've tested 37,954 as at 11th of April. The tests so far are taking place in Ghana at 6 centers. We've increased the testing centers, and these are centers in Accra, Kumasi, and Tamale. Very soon we will be adding Navrongo as well as the Tamale teaching hospitals as testing centers. But what is significant about Ghana's approach is that we are chasing the virus and trying to get ahead of it. We are not waiting for people to come to the hospital to report sick before we count them as corona positive. If we had not done the aggressive contact tracing that we are doing, we would not have found the 566 cases we have so far, because many of them would not have reported to the hospital as sick people. And this would have meant a much bigger problem for us later on, as more and more people would have been infected. As I said, this is not being done in many countries. So their reported numbers are no doubt an underestimate. In fact, if we had done what some of the other countries like the US and the UK and many other Africans are doing in terms of just waiting for people to report and then we count them, then our numbers for COVID-19 in Ghana would have been much less than 200. That would have given us a false sense of security. So the launch of this COVID-19 tracker app today is yet another important step by the government to leapfrog technology in finding solutions to the havoc the COVID-19 pandemic is wreaking around the world. We are trying to use digitization to help us in this fight. Many countries, such as the US, China, South Korea, for example, are using this concept of crowdsourcing from phone data to manage and track persons affected by the pandemic and offer health care, and more importantly, to avoid the spread of the virus. Learning from the experiences abroad, such as the South Korean example, His Excellency the President took the necessary steps to pass an executive instrument, the establishment of Emergency Communications Instrument 2020. And the executive instrument's main purpose is to use telecoms data through a shared common platform to fight this pandemic, with tools such as contact tracing, quarantine reliability, and certain related telephone metadata for the public good. The executive instrument does not in any way empower the President to assume any form of direct control over any telecoms company, more so to determine their operations. Considering that we are seeing an increase, though marginal, in community spread of the virus, the Ghana COVID-19 tracker app could not have come at a better time than now. It would, amongst other things, as the Minister for Communications has already mentioned, it will, among other things, trace contacts of persons infected by the virus through various telephone-related data and to link such people to health professionals. The tracker also provides information about people that were at the same event, the same location, or the same country, or other defined location-based function, as to know where they may have spread as a group over time. The tracker can also provide periodic lists of telephone numbers that are currently or recently have been in certain countries around the world to the Ghana Immigration Service for possible use in determining whom to provide an extra layer of screening. It is also useful in quarantine reliability to assess if certain individuals are required to self-quarantine are actually doing so. So this is yet another weapon we are deploying. Ghana is one of the few countries in the world to deploy such an app, and it will give us advanced information and allow us to respond quickly and treat early. That is why the COVID-19 tracker app is so important now. If you look at the current spread of the pandemic, it suggests that the virus has a mind of its own. It would therefore require innovative ideas, such as the application of technology, to deal with this pandemic. If Ghana hopes to flatten the curve or to stop the surge in numbers of people being infected of the virus on a daily basis, then this tracker app certainly offers the solution. Therefore, I will encourage as many Ghanaians as possible to download this app. And if you don't have a smartphone, you can use the USSD code. That means if you have a YAM phone, you can go onto your phone and dial *769# *769# to access the information and to provide some basic information to enable health officials provide the needed support, irrespective of where you are in Ghana. However, the best strategy in fighting the pandemic is to stay at home and observe all the World Health Organizations and the Ghana Health Service protocols, such as covering your mouth when coughing and sneezing, as well as regularly washing your hands with soap and under running water. Let us continue to adhere to these preventive measures to avoid the spread, save lives, and also help our dedicated frontline health workers who are working tirelessly to save us. On this note, I wish to commend all those who work so hard to make this happen in such a quick time. It is my singular honor to formally declare the Ghana COVID-19 tracker app duly launched. Stay home, stay safe, download the app. Thank you for your attention. May God bless you, and may God bless our homeland, Ghana.
The Vice President of the Republic of Ghana, His Excellency Dr. Alhaji Muhammadu Bawumia, sharing his thoughts with us, and of course declaring formally that the COVID-19 tracker app is duly launched. Well, I'm sure most of us probably are starting to punch our phones and hit our laptops and computers to find out how it is that we can get onto this. I reminded you earlier that much as it is that we are launching the COVID-19 tracker app, we also have a musical performance that will go on and on. We have Kwame Eugene performing tonight. Also, we have Fancy Gadam. We have Great Ampo. We have K3 Kwame Apia. We have Dada KD. We have Lucky Mensa. And then also we have Shatta Wale. But very quickly, let me ask the Vice President of the Republic. Your Excellency, thank you very much for your time with us, and we appreciate your thoughts shared with us. Now, if I may ask, sir. Very well, sir. How are you, sir?
Very well, sir. How are you, sir?
I'm very fine, Chairman General. How are you?
Very well, thank you, Your Excellency.
Very well, thank you, Your Excellency.
Very good.
Great. Now, let me ask this. You mentioned in your speech that the virus has a mind of its own, and as much as possible, everybody who can should stay home. Sir, how sure are we that all these interventions were put in place, including the launch of the tracker today, would solve the issue at hand?
Well, the thing is that this is a new virus. Even the scientists are trying to understand it. But we know that it is spread through contact or close contact. And this is why the science is telling us that we should maintain social distancing and we should do the necessary hygienic things such as washing our hands and you know, making sure that we keep these distances. So there's many strategies that are being employed, but ultimately we need data to be able to follow this virus. And so some of the strategies that we are will give us this data, and the digitized environment with the tracker app and the testing and the tracing and so on, they are all going to be contributory factors in helping us deal with this. I don't think that there is a single solution that we are going to apply as at now. We are still understanding it, updating our information every day and changing our strategy if it is required based on the existing information. So we are trying to do what the science tells us to do and what the data tells us to do and what the country experiences are telling us to do. The president is very much on top of this matter and will apply the strategies as is deemed to protect the people of this country.
It's not a very exciting time to be vice president, is it?
Vice President.
So can you repeat your question?
I was just asking, it's not a very exciting time to be vice president, is it?
Well, I think that God does everything for a reason, and we have the responsibility, as I have, to support the president. He's asked me to chair, which I am very happy to chair, the COVID monitoring committee, and so we are on top of the issues, or trying to be on top of them on a daily basis to support the efforts of the president in dealing with this. But I think that for all Ghanaians, not just for a vice president, I don't think this is a very exciting time. For all of us, we have to come together as one country and put our shoulders to the wheel. This is not a time for partisanship. It is a time for us to come together as one nation to fight a common enemy.
The Vice President, there's a certain level of despondency and negativity about the preparedness of our country, health-wise, government-wise, and all of that. Some have said that looking at what we're doing in terms of the lockdown, it doesn't look as if we're achieving the desired results. Are we going to strengthen the lockdown methods?
Well, I think that the president has said that we are going to follow the science and the data in doing this, and all the measures that the president has announced has been, based on the science and the best advice that all the scientists have on this. So you can see what we are doing in Ghana is very consistent with what is being done in other parts of the world. And as I said, what we are actually doing also, we are actually ahead of some of the most advanced countries in the area of contact tracing, for example, or testing per capita. We are quite far ahead. But what this has exposed in all countries, including the most advanced countries, is the weakness of our health systems. It has exposed, you find places in like the UK, the US, Spain, Italy, all their health systems have been challenged by this virus. And so we have to do more and to make sure that we get more done and more investment in our health sector and so on. But this virus has really exposed weaknesses across the world in the healthcare system, and Ghana is not immune from that. But I think we have lessons to learn from that, which I hope we will all learn.
Your Excellency, very finally, social media is awash with all kinds of information. And then also there's a certain feeling of despondency amongst a lot of people that we are not doing enough. You have the expert advice. Should we brace ourselves for more stringent measures as we go along?
Well, I think that we have to follow all the advice that we are given. I think that there is a sense in which some of our compatriots may not be taking the whole issue very seriously. You heard yesterday, for example, that in Choco people went to the beach yesterday, notwithstanding all the admonitions that we should stay away from large gatherings of that nature. So I just want to appeal that we follow the advice that is being given and we stay at home when we don't have to come out. And the president and the government will take the decisions as the data and the evidence and the strategy evolves, and I think that we should wait for that to happen. I don't want to signal that there's going to be more stringency or less stringency. We will have to look at the data and make decisions on that basis and follow the advice of the science.
Your Excellency, you sit in a position of advantage. You know more than a lot of us do. Ghanaians are watching, the rest of the world is watching. What would you say to Ghanaians as Vice President of our country?
Well, as I said, we are going through a very difficult time in Ghana, as the whole world is also going through. The world over, we are dealing with something we haven't dealt with before. It is requiring a lot of sacrifice. We have thankfully got a very, very visionary leader in Nana Addo Dankwa Akufo-Addo, who is setting the tone and bringing this country together. It is very, very important that we stay together as a country and support the president, regardless of your political party, and leave politics aside for now, and let us support the president to fight this battle together, and let's speak with one voice in Ghana, and let's follow the directions that will keep ourselves and our families and our neighbors safe. Let's follow the directions. Let's keep the social distancing. Let's wash our hands and so on, and we will be fine.
Your Excellency, thank you very much for your time. We appreciate your time spent with us.
Thank you very much, Chairman General, and my regards to everybody. Thank you.
Thank you, sir.